Hi, Yolanda. How are you?
I'm well, thank you.
Thank you for coming and speaking with NewBeauty today about your facelift and necklift experience.
Absolutely. It's my pleasure.
You specifically had a deep plane facelift and necklift with doctors David Lieberman and Sachin Parikh. I'd love to hear your story and for you to enlighten us a little bit more about deep plane facelifts and necklifts.
Well, I've been in the aesthetics industry for over a decade now, and I would say I wouldn't have known that I needed or wanted a deep plane, but I've been seeing the results of a deep plane for many, many years. Ultimately I said that was the right treatment for me based on the results that I've seen.
And can you say how old you were when you had your surgery? Because I think it's kind of how it's going with a lot of people now. Facelift surgery in particular is trending a little younger.
So I was 49, and I specifically thought for myself, I wanted to have this before my 50th birthday.
Before your 50th, so like as a birthday gift?
It was a birthday gift to myself. I wanted to make sure that I did it before my 50th birthday party. So I did it in June of 2021.
It feels like a scary, procedure to even think about. So what was your facelift and necklift like, and how did it go?
Sure. So it's surgery. I think it would be abnormal not to be a little nervous. In terms of the surgery and recovery for me, it took about 2 weeks to recover. It was quicker than I thought. Overall, I think the toughest part was just getting here and taking that next step. The first 3 days, I think, are probably the toughest for patients or just like myself, because you're getting into the mode of all the anesthesia's coming out of your body, and you get to the point where you realize, oh, I just had surgery. I did this.
Well, I would never, everyone's saying now we're in the era of undetectable surgery. I would never think that you've had a facelift. So your results look beautiful. How do you feel about your results? What were you seeking to improve, and how does everything look now?
It was a bit surprising for myself that I made the decision in my 40s. I never thought I would have a facelift in my 40s, never. But I kept seeing people have facelifts with us here at LNP, and I realized that it wasn't the look that you saw in magazines. It truly just restored what either you looked like before or just gave you a bit more rejuvenation. It's interesting because I think most people think that a facelift will make you look drastically different. And for me, it was a refresher. It just felt like me, but better.
And what areas did the doctors focus on? Did you have a full facelift? And you're so right, because in my mind, I always think, oh, it's going to be so pulled or unnatural. And lately, a lot of the results I'm seeing are so amazing. People are looking like their own daughters. So what areas exactly did the doctors focus on?
So it is mid face on down to my neck. And that is the deep plate facelift that I had. Luckily, genetically, my mom and my grandmother had great skin. That was never the issue, but I looked exactly like them. And my jowls were starting to sink, my cheeks were starting to fall, and my neck was crinkly. And so that's basically what I started to notice. And so by addressing the mid face on down, it really just put me back to where I was years and years ago.
Well, you look gorgeous. What about scarring and healing and all of that? Was that a long process? And are your scars, visible, or are they hidden?
Yeah, so there are scars that come from the temple all the way in the ear, and you can't see them. I tell a story about how I started dating someone about 8 months ago, and we had the conversation about aesthetics. And I said, well, I'll be doing things until I can no longer do them. I said, I feel really good, and we have the best doctors. And he says, just don't go getting a facelift. I
Too
was a
late.
little, yeah, I was a little shocked by it. I said, no, the doctors are really good here.
Yeah. It doesn't, I mean, today's facelift, the techniques are so sophisticated. Even you just showing me where your scars are located, I still don't believe you. So
Thank you. No, they're not detectable. I mean, I think it's a big fear, right? no one wants to have a scar. But I think understanding that, one, they're hidden in the ear and even up in my temple, like you can't see them. No one knows. My family didn't even know after I recovered. I had to tell them. So it's pretty amazing, pretty impactful.
And how do you feel post procedure?
Yeah. You know, I would say for me, it's been the best decision because for me, it wasn't about what other people saw. I think what it's done for me is that it's freed up headspace, I guess. I don't think about the crinkles in my neck. I don't think about any of the jowling. It gives me time to focus on things that are more important in life. And for me, it's eating better. It's, you know, working out. It's spending time with my son and not freaking out that I'm going to take a selfie and you can see this like crinkle in my neck. So it
Right.
just saves time.
Well, you look beautiful. I want one next, so I'll just
We're here.
I'm gonna start planning it now. Okay, and then also at LMP Aesthetics, you have this great unique approach where Dr. Lieberman and Dr. Parikh performed the surgery together. Was that a huge factor in you deciding to have your facelift with them?
That's a great question. So, the surgeons are really, really good, and anyone can do research on a surgeon online. I think the thing that I've noticed is that because they're both in surgery together, you have two people trying to really make sure that the end result is what they believe is perfect, right? And so for me, it's it was really good because I was able to speak to both of them after the treatment or surgery. They could both answer questions for me. Probably not the best business decision on their part to have both of them in there, but I think from a results basis, you kind of have a lot of security in that you have two surgeons in there working on your facelift and leaves very little amount of air and also just pushes both of them to be better. So I was really confident with that. It made me feel really good that I had both of them.
Yeah, they do amazing work, and you're a testament to that. So, thank you so much for sharing your experience with us. I think a lot of people wonder what a deep plane facelift is. So, I think this helps demystify a little bit about it.
Thank you, Tatiana.
Thank you. Hi, doctors David Lieberman and Sachin Parikh of LMP Aesthetics. How are you today?
We're doing great. Thank you for having us on this podcast. We appreciate it.
Thank you for speaking with us about the deep plane facelift. We know a lot of patients know the term deep plane facelift and deep plane neck lift, but what does it really mean? How is it different than a traditional facelift technique?
Take this first question, and it's a question that we get all the time because I think the landscape is a little bit confusing because there's so many different terms to describe facelifts and neck lifts. At its core, a deep plane facelift really addresses the fundamental causes of the aging face and neck. What we are doing or what we're performing during the deep plane facelift involves taking tissue that has naturally just part of the aging process descended and deflated, and we're simply just repositioning that tissue. That does involve some critical steps. That's going to involve release of certain ligaments in the face that is holding or locking that tissue up. And then it's going to involve really a critical eye in terms of how you want to resuspend that tissue, where you want to put it in order to kind of create a youthful, natural result that is dramatic when you are looking at someone before and after, but when that person has healed and walked into a room, there's nothing dramatic about that result. You just wonder why that person looks so good for their age.
I think in terms of the neck portion, because as the popularity of deep plane lifting has risen, the popularity of deep neck contouring has also come with it. The concept here is that in addition to muscle laxity, skin laxity, some soft tissue laxity in the neck, some of the deeper structures play a big role in blunting the shadowing and definition of a neckline. And you can use deep plane techniques to create nice shadowing along a jawline. But oftentimes, if there's a lot of bulk in the deep neck contents, then you're still going to be left with a lack of definition in certain components of a neckline. And so in deep neck contouring through this midline approach, which we'll do at the time of our deep plane face and neck lift, we're going to be evaluating the bulk structure and position of those deep neck contents and contouring it when it's appropriate, really with the goal of creating appropriate shadowing, definition that is soft, not sharp, but really allowing the shadowing underneath the jawline to shine.
Is that what helps make it so undetectable?
I think there's a combination of things that allow a result to be undetectable. First and foremost is your access points, which are your incisions being hidden in those natural crevices or shadows, around the ear, behind the ear, along the hairline. And then to what David was saying, there's a softness that you are trying to achieve with every result. There are times when people can look over-operated, and that's not something that we strive for. And I think that just comes down to an individual's anatomy and an individual's aesthetic. When I explain what a deep plane facelift and neck lift addresses, and sometimes patients do get overwhelmed with all the information, I'll just talk about 3 areas. And David was alluding to the neck. That's the first area. The second area is the jowl or the jawline and the shadowing that we try to create underneath. And then the third area is resuspension or lifting parts of the midface up. And those are the 3 areas.
So you perform all of your surgeries together. How does this approach really benefit the patient? I mean, I know I would want both of you in the operating room with me at the same time, but just to spell it out.
Yeah, so I think this model started from the first day of our practice, really as a way to kind of learn from each other as we were treating patients that we saw in consultation. And what we found is that we created this built-in sounding board and sort of like a soft criticism space for each other, really meaning that if you have 2 sets of eyes looking at a structural or surgical path, then you're going to both be thinking about what's the absolute best thing you could do at any one small step in a surgery. And if you're operating on your own, you're often thinking to yourself that same question. Having 2 sets of eyes, especially during certain critical parts of a deep plane lift, turned out to be a significant benefit in terms of taking our results, forward at a really fast clip early in our career. At this point, we see our own patients. We are primary surgeons on these cases. But to this day, during deep plane face and neck lifting, the key portions of the procedure, we are working together and we are still critical of what each other are doing in a way that doesn't feel hurtful to us, because we are really just in this to try and achieve the best results possible. And to us, that's our main objective. And it's created a space for us to really keep our surgical skills at the top of our game, to push boundaries in terms of what we can do aesthetically. And I think it's worked out in the best interest of our patients, which is really the most important thing.
So for someone who is considering a deep plane facelift or a deep plane neck lift or the combination, what are some factors that they should look into before deciding?
It's a good question. I think obviously over the last 10 years, there's been a trend towards earlier surgical intervention for people that either have burnout when it comes to non-surgical measures or fear when it comes to non-surgical measures. I think non-surgical measures have a role for sure. But if you are someone who is bothered by soft tissue changes, soft tissue descent, or noticing changes in your facial skeletal or soft tissue structure that are bothersome or are impacting the way you feel about your presentation, I think it's worth starting your research. And I think this is a big decision for any person. And I think the timing of it is incredibly particular to the individual. And I always say that the right time to do this is when it feels right to you, because that's actually, I believe that fully. I think if you're, someone in your 40s or 50s and you start to notice sort of a collection of the soft tissue around the mouth, where what used to be suspended effortlessly up on the high cheekbones in front of the ears is now collecting and creating shadowing around the mouth. There's a softness in the neck or a blunting of that shadowing. these are changes where you can create some improvements non-surgically with camouflage maneuvers, but fundamentally, the way to treat this is by appropriately releasing that descended tissue and putting it back to where it was, in your youth. I believe really strongly in the concept that he just mentioned about this concept of dramatic outcomes. If you look at a before and after photo in a good surgery, that's typically traumatic. But the after person, the person who's undergone surgery, there's nothing about their outcome that should look dramatic independently. It should just look beautiful.
Right.
And
Natural.
that doesn't happen by accident. I think that's really about technique.
Technique and who you choose to go to for your procedure. That's a huge factor as well. Well, thank you so much for your time. And this has been really enlightening. And I hope it helps someone who's considering a deep plane facelift and neck lift. So thank you.
Thanks for the opportunity.
Thank you for having us.